Hi, it's Doug Holland LMT with another massage tip for massage professionals. Today we're going to be talking about Dupuytren's disease and how we as massage therapists can help. Just as a reminder, we know that Dupuytren's disease is inflammation and thickening of the fascia, or what we call the palmar aponeurosis of the hand. It can cause a lot of pain, and it can cause range of motion issues in the hand. It can become difficult to grab things. If it continues to progress, it can actually grab onto the flexor tendons of the hand and cause a few of the fingers to actually contract. When it gets to that point, it's called Dupuytren's Contracture. So that's usually the farthest progression of the disease itself. And if it gets to that point, really as massage therapists, there's not a whole lot we can do. But while the fingers are extended in the early stages of the disease, we can have a profound effect to bring relief to the patient itself. So here's my tip on how I work Dupuytren's. What I do is I get the patient to lay in the supine position like this. I get the arm into full extension, and then I wrap my fingers between theirs. So I force my fingers between theirs, and my index finger is between their thumb and their index finger. And then I let my thumb go over the top of their thumb. What I do then is once the arm is fully locked out, I actually pull it. I'm pulling it with my hand itself so that I get the full extension of those posterior extensors. Then I dorsiflex the hand like that. Now they're really ripping, they're really pulling. And this gives me full exposure to the palm itself. Now with the hand fully dorsiflexed and the arm in extension, I take my thumb, I brace it with my fingers behind the hand of the patient, and I hook my thumb into the thenar eminence first. I work that pad of the thenar eminence, and then I start working my way then into the palmar aponeurosis. This hooking motion is designed to break up fascial adhesions. It's designed to reduce scar tissue, and it's also designed to break down inflammation. We know that the palmaris longus inserts on here. If we have golfers that have medial epicondylitis, they'll also have a difficult time swinging a golf club if there's the thickening of this tissue that Dupuytren's actually does. So we're going to hook into this. I'm going to spend about 2 full minutes on the first treatment on this palm, digging in here. I won't usually go more than that because it can actually undo the good work that you do. But remember, keep that hand dorsiflexed. Keep the arm locked out, and that'll really open up this tissue for you so that you can do a really good job. Well, that's my tip to you. And just remember this. If there's no discomfort on the table, well, what do we say? It's nothing more than a foo-foo massage.